Good evening. My name is Selena Joffrey, and I'm the Director of Business and Policy at Asia Society Texas Center. Thank you for joining us for week 3 of our webcast series on COVID 19, which explores various themes and topics impacting our larger community. This evening's webcast is on the economic and financial impacts of coronavirus. How do we get back to normal? And our featured speaker is Ali Velshi, who is an award winning journalist and an anchor with MSNBC, and to whom we are very grateful for making the time to share his insights. You'll hear more about him and from him in a moment. Our moderator for this evening is Marty Goosen. He's vice chairman of JP Morgan Private Bank and a board member of Asia Society Texas Center. Before I hand it to Marty to start the discussion, a quick note that following the conversation, we'll be taking some questions from the viewers, so please share your questions throughout the discussion via the YouTube comment box. Thank you.
Thank you very much, Selena. It's a real treat to have my good friend Ali Velshi with us this evening, commenting on, I think, a topic that's extremely topical for all of us in Texas, in New York, where he's sitting tonight, or any place in the world. Just as a brief introduction, Ali was born in Kenya, was raised in Canada. We're forgiving him for that. And now he's firmly based in New York as a major broadcaster, now working with MSNBC. He worked for years as CNN's chief business correspondent, helped establish Al Jazeera America, and is now with MSNBC with a twice weekend show on Saturdays and Sundays between 8 and 10. And I encourage you to tune in if you happen to get up at that time of day. In any case, let me just welcome you, Ali. It's just so pleased to have you with us. You are a great supporter of the Asia Society Texas Center here in Houston. We had you here last February when you and I had an animated conversation on our stage. Unfortunately, we couldn't get you here to Texas to do this time, but we still got you, and we appreciate you. Thank you very much.
It's my pleasure, as always, Marty.
Great. Ali, tonight I want to cover 4 topics. I want to cover the virus, but we know a lot about the virus. I'm going to give a few statistics as we get on. But I do want to talk, you're a business specialist, business correspondent. I want to talk about the economy, a bit about the markets, but I think the real thing that people are really wanting to talk about, of course, the government intervention to help those 2 items out. But then we want to get to the path to normalcy. And we're going to have probably an interesting debate, what is normalcy, as we go forward. So if you don't mind, that's the range of topics I'd like to cover.
That sounds great.
Great, thanks. Let me start just to put some facts on the ground, because it's an ever-changing scene, unfortunately. As of this morning, there are 2.1 million cases in 185 countries around the world, 140,000 deaths, with unfortunately 6.7% of those known cases have passed away. In the US, we have over 640,000 cases with nearly 32,000 deaths. And those numbers are rising every day, as we know, perhaps at a slower rate, but they are indeed rising. Texas here, where we all are, and most of our listeners will be this evening, we have over 16,000 cases, but only 391 deaths, which is a death rate substantially lower than we're experiencing elsewhere. And in Houston, where we're sitting, we call it Greater Houston, which is a 9-county area. There are over 6,000 cases. As of this morning, 6,070, and just 102 deaths, which is a 1.7 rate, death rates. But we know that those numbers are not over, and we know they may not be complete. So we're going to keep our eyes on that. I want to put some of those numbers in a little bit of context, though, because during this crisis, we've talked a lot about SARS, for example. I was surprised to learn there were only 8,096 cases of SARS, 8 in the U.S. There were 774 deaths related from SARS. This is in 2003, and there were none in the U.S. MERS is another case of Middle Eastern Respiratory Syndrome, 2,500 cases, 866 deaths, virtually none in the U.S. The one that everybody loses sight on is H1N1. 60 million people in the United States were infected by H1N1. It was about 30% of the total population of the world, 24% actually, but a much lower death rate. 12,000 people sadly passed away from H1N1. So these viruses are all over the place. That was just basically the point. Viruses are all over the place, and every time we confront one, we're learning something new, aren't we?
Correct. Correct. There are a few things to take into account here. H1N1, there was a prophylactic available very, very quickly. It was just in short supply. So there wasn't the same sense of this 1 to 1.5 year lag with a vaccine or a treatment. So that's part of the problem we've got here, the idea of this mortality rate. And the other thing, Marty, both of us deal with numbers in the course of our lives. The problem with trying to make sense of why your mortality rate is lower in Houston than it is in New York City has a lot to do with the denominator and understanding the denominator. And that is something that has not been clear anywhere in the world with this illness because of the lack of robust testing, right? Until you actually know how many people are infected with this, you don't know how many people are getting sick with it. You don't know how many people are dying with it. So that's part of our problem. In a place like New York City, you can't even get tested if you are not going to be hospitalized for it. So there are lots of these cases which are said to be presumed cases because you're displaying the symptoms, but then we know that there are a whole bunch of people who don't have symptoms. So we haven't mastered the testing problem of this yet. We're now going to move on to other types of testing. One will be antibody testing. It should be very, very fast. You should be able to get results within 5 minutes. It's not the kind of thing you can do yourself, but hopefully we should be able to do that to determine whether people have the antibodies for this virus and will allow them to resume work or to go back out. So that's where we are. You'll notice the market futures are up tonight on the promise of a drug for treatment of coronavirus from Gilead. Again, we don't know enough about that. Market sentiment tends to be such that it tends to invest in hope and ideas. But we are in the midst of a crisis in which we lack sufficient visibility and information, sufficient data, and that's part of what the market insecurity is and the economic insecurity is. We don't know what the future will hold, and that for markets is really tough, and as we're seeing for everyday Americans is really tough.
That's for sure. We're going to talk further about testing as we get closer and talking about the return to normalcy. Let me give you a quick timeline too. You know this, but all of our guests would like to hear this. The first case that was confirmed, we think that the first case was identified by the WHO on December 31st, and that there's some questions about when China first heard about it. But the first confirmed case in the United States was just on January 21, which was just 4 months ago. It's just amazing. On February 29th was the first death in the United States, and that's just a matter of just 2 months ago, not even 2 months ago. And then on March 27th, we finally passed a stimulus bill for $2 trillion, to get there. But I have some other numbers that are just interesting. On January 31st, China had 12,000 cases. The second most cases of any country in the world was Thailand, with 19.
Mm-hmm.
And on January 31st, the United States had 6 known cases. Again, testing, who knew, had to be sick, I get it. On March 1st, basically a month later, China had now 80,000 cases. Italy was now number 2 with 1,100, and the United States had gone to 62 cases. Now that was March 1st. That was 46 days ago, or whatever it is. At the end of March, the United States had become the number 1 sufferer of this disease with 144,000 cases. China was still number 2 with 82,000 cases. And then on April 15th, just 3 days ago, the United States was by far the number 1 place in the world at 637 cases. Spain was then number 2, 180,000, and China had fallen to number 7 on the list because they had contained it. And that is part of this issue of flattening the curve, and we still haven't done that quite early. Spain has flattened the curve. Italy has clearly flattened the curve. Disastrous places. It's been a human tragedy of immense proportions. But those are just the timeline here is also, I think, a great surprise for all of us, how quickly this unfolded.
It's been remarkable. I mean, on one hand, you see these memes on the internet that, I saw one today that said, today feels like April 942 or something because it drags out. But that is, when you look at it in a temporal layout like that, this has been very, very, very fast. I recall in late January first reporting on this. And then I recall at the beginning of February discussing the fact that we had cases in the United States, but we hadn't had any community transmission. That's the word we were using back then. And, this was before real conversations about social distancing and all that. It was the idea that that will mean that it's here. The first time somebody gets it from someone whom they didn't get it, whom they didn't travel with, or who wasn't their spouse, or from somewhere else, is the point at which it enters society. And again, we've got the testing issue, but we've also got, we're not clear on what is it about the way in which we live here, China, Italy, Iran, Thailand, South Korea, different places, that allows this to spread or be contained. Because when we talk about containment, we've got other viruses and diseases to use as examples of this. Containment can mean different things. We have taken to being at home, because we don't really, part of that is because we're just not experts at this, right? It's almost impossible to live where I am in Manhattan contained. You just have to interact with a lot of people in the course of everything you do. So part of it is our severe reaction, to which some people in America are reacting very badly, is because we don't really know what containment is. We don't have sort of disciplines around containment, and we don't know what it looks like. So containment and then herd immunity are two different issues. And as well as we are containing, we're not sure we're getting to a place with herd immunity. So if we do what you and I are talking about, get back to work in an orderly fashion too soon, you could end up with a resurgence like we see in some places in Asia.
That's right. And of course, a lot of this containment is basically antithetical to the U.S. concept, or to most Western European. It's just antithetical to who we are as people. We are, one of the criticisms that Dr. Fauci got from a comment he made recently is maybe we should never shake hands again. Well, the old days, as I understand it, the idea of shaking hands was to prove that you didn't have a weapon in your hand. And, we've been proving we didn't have weapons in our hand. We may have them in our pockets, but we didn't have in our hands. And that's something that has been part of our culture for a long time. I lived in Asia, as you know, for 28 years. And, a lot of Asia just bows. They don't shake hands. Yes. They don't come with that culture. And so I started, at the Asia Society Tiger Bowl not long ago here in Houston. I was bowing to everybody, and I felt like, heck, we're at the Asian Society Ball. Let's go bow. Let's stop shaking hands. But it's so hard for people to stop shaking hands, which, by the way, you got to get within 6 feet to shake hands. I mean,
right. And so those are, part of when we talk about, and when we get into this, we'll talk about it, but part of getting back to normal is what's normal going to look like.
Yes,
right. I've no doubt that Americans have the ingenuity to figure out how to get to something. I mean, when on the eve of 9/11 and in the days right after 9/11, I was here in Manhattan, and there was nothing that would make you think you were ever getting back to normalcy again, ever. And yet we have achieved normalcy. There are changes to our lives, some of which we'll remember. Some young people who are watching us today will not even know those changes took place. Same thing after the Great Recession. There were things that looked like they would never come back to normal. And certainly some things were broken for good, but lots of things get back to normal. So we'll get there. The issue is, should we be bracing ourselves for the fact that normal means something else, socially, socioeconomically, economically, financially? And I think that's some of the thinking that we've got to get into now.
We'll get in that a little deeper. Let's shift to the economy quickly, because at the end of the day, the reason we're talking about this is not because we're worried solely about getting sick, and we should be, but we're also worrying about it because the economy has had an absolutely extraordinary reaction for a lot of reasons we'll talk about in a second. This morning, we learned that there was another 5.5 million people who had applied for unemployment insurance. So we now have 22 million people who, in the last 4 weeks, have applied for unemployment insurance. In the years from 2009 to 2019, the recovery from the Great Recession, we created 22 million jobs.
Right.
Those 22 million jobs aren't gone, but the people that were in jobs, 22 million equivalent number, are no longer working because of this virus. We expect, JP Morgan's actually, we were the first ones to come out with a GDP forecast for the second quarter at negative 25%. We revised that last week to negative 40% for the second quarter of 2020 in the United States. And by the way, it's even worse. We just revised our, in other countries, we revised Mexico to 35%, to Western Europe to 45% negative. These numbers are just extraordinary. And one other interesting statistic, I saw this in the paper this morning. TSA on Tuesday, processed 87,000 passengers across the entire United States. I don't know who those 87,000 people are.
That sounds big.
Let's find out. But the same day, in 2019, TSA processed 2.2 million.
Yeah.
It's a 96% decline of people flying across the United States. So, I mean, this is really something. What do you think about the economic impact at this stage?
Well, so let's say this 22% number, the way, there's not a direct correlation to the unemployment rate, but a lot of people think about the unemployment rate. Before coronavirus hit, we were at 3.5%. The first unemployment report after coronavirus, which came at the beginning of April, was for March, and it was measured in early March, took us to 4.4%. Before this week's unemployment claims numbers, the estimates were that we were probably at 13% unemployment. So this probably puts us above 15% now. And a lot of mainstream Wall Street economists have been sort of talking about 15 to 20%.
We're saying 20. JP Morgan saying 20 right at this moment.
Yeah, right. So and there are some estimates that are yet higher. Now, we didn't get past 10% in the recession,
Nope.
and we didn't get past 24% in the Great Depression. So these are numbers we have never seen before. That said, they're for a reason, right? In the Great Depression and in the recession, those jobs were destroyed, and an economy had to grow them back. This is a different situation. The jobs that we're not doing today have not been destroyed. They've been North Korea style disappeared, right? The job just stops. The place can't have you go to work. So the restaurant on the corner near my house isn't failing for any other reason than they can't go there. And so, mathematically, you might say, well, when these work from home orders are lifted, and New York has just extended it from May 1st to May 15th, that non-essential businesses need to stay closed. But, in theory, on May 15th or May 16th or May 20th, is the bar on the corner back to normal? Are the restaurants back to normal? Now, obviously, they'll have to do certain things like social distancing. And in New York, it's not something we do in New York. It's not something you do in Hong Kong. It's not something you do in London. It's, cities in the world are dense places. You don't social distance on the subway. You don't social distance at a bar. You don't social distance in a restaurant. So that may change. But what will we do then? Will we be frightened of other people? And the reason I keep using our prior examples, like 9/11 and like the Great Recession, both of which we remember, or even the other infectious diseases you talk about, in none of those cases was I generally worried about harm coming to me from my fellow citizens, from my fellow city dwellers, right? With 9/11, it was a little weird because sometimes you'd be on a plane and you'd worry about it, or at an airport or in a public place. But generally speaking, we learned how to cope with those things. This thing is weird because we are not yet learning how to cope. Now, if you walk outside Manhattan, if I go outside my house, we are compelled to wear masks in New York. We are compelled to social distance. If you go to the grocery store, they've got squares that tell you where you stand and where the next person behind you stands. There's a piece of me that says we can figure all that out, Marty. We'll figure out how to shop. We'll figure out how to do things. But what won't we figure out? What scar will this put on us forever? And I'm curious about that. I'm curious about what you think about that, because again, when you think about 9/11 and terrorism, do you still live with any scars from that? In other words, we now don't believe that terrorism is an existential threat to our way of life. But at the time, we did.
No
and
question.
it feels like an existential threat to our way of life.
No question. And by the way, just getting on an airplane today is a completely different process than it was 20 years ago, right? Well, so this is the third time I can count where the government's actually forced a significant recession on us. In 81, 82, Paul Volcker did it when inflation was at 13.5%. And he did one thing. He raised interest rates to 20%. And his sole purpose was to basically slow down, not shut down, but to slow down the economy. Of course, 9/11, we stopped travel for a different reason, as you say, existential, but it had a massive impact on psyche, not just the economy, on psyche. And of course, this one is one we don't know how long it's going to take us. One of the questions people are asking, well, how much of this, and we suggest how much of this is demand destruction, and how much of it is demand delay? Well, some of it is demand destruction. You're not going to go eat dinner 5 times when you finally can go to a restaurant, right? You're going to go once. And so people aren't going to restaurants now. That's not coming back. But some of the other things, Amazon is hitting all-time highs in the stock market because people are shopping every day. So that's demand that it's ongoing. And maybe there's some demand delay of things that clothing is the hardest hit retail space. It's down over 50%. And does that mean that people aren't ever going to buy any more clothes, or maybe they go out and buy 2 suits instead of 1 suit? That may happen. Some of that will come back.
Right.
But these are interesting theories that we're just going to see play out.
And then you'll see the innovations that occur, right? We know that people will still buy things, but they'll change the way they buy things, or maybe they won't be going out to shopping malls to buy them with the same vigor that they did before. But you'll get better at it, right? There'll be companies that will get better at giving you what you need in these times. We've seen a lot of companies pivot from what they manufacture into manufacturing the things we need right now. Some of which are urgent, like masks and sanitizers. Some of which are less urgent, like ways in which we can communicate or sanitize your phone. There's a device that I bought that has UVC lighting, because we know that UVC lighting actually kills this virus. You can't have it all over your house, but you can have it in a little case that kills your phone. Zoom, that you and I are talking on, is doing phenomenally well. Netflix, NBC, my parent company, early released a streaming network called Peacock, because they figured, hey, everybody's home. Why don't you release it now? Peloton is doing very well. So there's some demand destruction and demand creation at the same time. What we won't know is what the net of the whole thing is, right? I eat probably the same number of calories every day, but prior to this, I was taking most of my meals outside of the house. So that demand went away. But I still replaced the calories. I just did it in a more efficient fashion in which it gets delivered to my house, and I prepare my food. So my demand for food hasn't changed. My demand for the experience related to food has changed. And again, I don't know whether that'll snap back when we're finished, but you're right. Even if it snaps back, I'm not going to go out to make up for all the time I didn't go out for 3 months. So we have to think about those kinds of things. Retailers in shopping malls were already struggling. We've talked a lot about coal miners and the difficulties they have, but in fact, no industry has lost more jobs in the last 4 years than retailers. So that's already been struggling. But as you see the demand destruction, it's not demand for the things retailers sell, it's demand for the way retailers sell the product. So we've seen that evolved and changed into these computers again. Our phones and our computers are now these valuable things that we all had sitting around the house that are our lifeline to the outside world. So I think there's stuff that's going to bubble up, that's going to be interesting, that's going to replace our need to do things in a safer manner.
So this demand destruction question, of course, just to bring this home for us here in Texas. So we had absolutely 2 perfect storms. We had 2 black swans collide as they were on their way to the pond. We had the demand destruction of everybody shutting down their cars. I have a car that hadn't been driven in weeks, sitting downstairs, haven't put gas in it in weeks. And that's true all over the United States. The demand for oil is gone to zero. The refiners are completely clogged up and there's nothing going, and that hurts Houston miserably. Secondly, we have a political crisis between Saudi Arabia and Russia that we're no party to, part of OPEC, that drives the price of oil. And so over the last literally 4 months, the price of oil has gone from over 60. Today, I don't know if it closed over $20 for WTI or not. That level of demand destruction is really, really crucial for our economies throughout the state of Texas. And we're really not feeling the full brunt of that yet. We're seeing bankruptcies virtually every day in the field. There's going to be a restructuring of the energy industry, but we can't, as much as the Green New Deal people would like, we can't go off fossil fuels on July 1st and all switch on alternative fuels. We're going to have to rebuild that industry, but it's going to have to be restructured as it comes out of this.
Yeah. So here's another, let's bring back a couple of past examples, 9/11 and the recession. At that time, in both cases, you had, generally speaking, led by the United States, what were called global coordinated efforts, right? In 9/11, it resulted in the attacks on Afghanistan and the war in Afghanistan, and then subsequently with, there was some mission creep and it ended up with the war in Iraq. But there was this concept of let's all face this together. In the recession, we had the same thing. We had the central bankers of all the major banks come together and do coordinated interest rate cuts. We didn't see that this time, largely because we got a fight between our own central bank and the president at the moment. But the distinction was what you would not have imagined is in the shadows of a major pandemic like this, that you would have 2 countries, Saudi Arabia and Russia, doing something to further hobble the global economies. One of those countries is an ally of the United States. So the idea that that was allowed to happen, given that the first trip the president of the United States took was to Saudi Arabia is, beyond comprehension. But this didn't need to happen. The demand destruction was going to take place, that's for sure. But the war between Saudi Arabia and Russia about the price of oil didn't need to happen. That was avoidable. We're starting to come out of that a little bit, but the damage seems to have been done, as you mentioned, that we've got a deal between Saudi Arabia and Russia, and we still haven't seen oil prices to the level you'd expect.
That's exactly the point. I mean, we did get an agreement. We did get a 10% or approximately reduction, 9 million barrels a day, what it is of decreased supply, but the demand isn't there anyways. In fact, some analysts are saying demand's going to continue to decline as this rolls across the country and across the world, and therefore even $20 a barrel may be generous where forecasts may put it for the future. But it is something that we worry about, obviously, here in our own community. And it's something that I know the people that are listening on in many cases are affected by. And of course, oil in an environment like Houston has knock-on effects in the real estate business, housing, and all sorts of other things. Everything. There are knock-on effects when you have that sort of challenge. Before I get to the government reaction, I want to talk a little bit about the markets, because I'm a markets guy. I sit in the markets. You've been a career business commentator, and here once again, unheard of numbers. Between February 19th and March 23rd, the market declined the stock market, as defined by the S&P, declined 34% in 33 days. It was the steepest bear market ever created, losing trillions of dollars of market value for shareholders. And by the way, there's still quite a few people, maybe more than 50% of people in the United States, have stocks in their 401ks or their IRAs or someplace, and that's a massive concern. That's a real issue. But after that massive bear market, we had the fastest bull market we've ever had, as defined by a market goes up by 20%. It's recovered 25% to today. In fact, it did that in about 10 days. And how do you read the way the markets have been positioning for this?
All right, I'm gonna do something unorthodox for these things. We're gonna go for a little walk in my my New York apartment. This has become my studio. Pardon me for the darkness for a second. It'll all change. This is my
okay, everybody out there. This is unscripted. Okay.
I'm putting on. This used to be my living room.
All right.
And this is the camera, and that's the set. That's a 65-inch TV, which is the set. That's the anchor chair that I sit in, and then that's the front of the camera. I haven't switched anything on, but I've got monitors and camera. But what I've got right next to me are charts, right? I've got market stuff. So I've got there. I've reminded people this is about a week old, but the year to date the market was down 19%. You probably see this backwards, but it was down 19%. But I remind my viewers all the time that as of a week ago, for 5 years the market was still up 25%. For 10 years it was up 122%. Right? So I'm always trying to give perspective. And then I've got some charts down there. Again, you're seeing them backwards, but this is recession since 1948. And this is a S&P 500 20-year chart. So I do this only to remind people that markets are good. They're efficient. They come back 1 month after 9/11, when it really was existential and it really looked like it was going to wreck society. Sorry, I'll be out of a shadow in a second when I get back here. All market losses were recovered. Now, it took longer after a real thing like the recession that really was about demand destruction, not forced by the government. So the difference, Marty, between you and me now and what we were 10 years ago or 15 years ago, when the Dow was down by, the S&P was down by 2 or 3% in a day, which was usually, that was not usual. I could go on TV, and after doing a little bit of studying, I could figure out what triggered the markets on that given day. The difference today is velocity, right? It's high frequency trading. So sentiment plays a much, much bigger role than sensibility does in markets. First of all, today, there are companies that have given up 30 and 40% in the last month where it doesn't make sense. There's some that totally make sense, right? If you're invested in certain industries, you can say, this is not going to recover for a long time. I can definitely see why this didn't work. Or you could look at a company like Delta and United. And if you're looking at actual earnings, you can say, all right, we're definitely not going to have those earnings in 2020. But unless I think Delta is going to zero, the response might be a little bit irrational. So what I think you're seeing is the thing that is worst for markets overall is a lack of visibility, right? Lack of clarity, the lack of testing, the lack of the denominator, the lack of a vaccine, the lack of understanding how many people will get this, how many people will die when business opens up again. That is always the kind of stuff that scares markets. But layered upon that in 2020, you have high frequency trading in which decisions about investment are not made by managers who know their companies and have really given thought to what will this company in which I'm invested look like on the other side of coronavirus? What will it be? Can it thrive out of this environment? Can it pivot? Can it deal with it? That's not what happened in the massive sell-offs. Everybody just bailed out of the markets en masse, left all 8 segments of equities and went into other things, mattresses and cash. And so that kind of behavior is understandable, but I think our viewers tonight need to understand that it's not sensible behavior. So if you didn't sell out, if you were one of those people who didn't, and you've got a time horizon of 5 years or longer, I think you'll be fine. And I think you'll be probably more than fine.
Well, I'm going to play that back for all my clients. That's very nice. Thank you, Ali. That's what we would believe. We believe that the stock market is based on valuations over time, but there are interludes when consensus, for one reason or another, they don't see the bottom of the hole. It's like going in a dark room, you don't know where the door is, and and the only door you know is the one you just came from, and you got to get out of it as fast as you can. But one of the interesting things in this situation was, and maybe 0809 taught our government a lesson. They moved so fast to do things. The Fed first moving with $2.3 trillion of support of all sorts. In this occasion, they moved rates to zero in 17 days. It took them 300 days to do that in 2008.
Yeah.
They started QE2, quantitative easing, in 17 days. It took them 286 days to do that. And there was a lot of political rancor. If you remember Hank Paulson and Bernanke and everybody having to really explain themselves and going down in front of commissions and things. Yeah. We had been through that experience. We realized that it worked. And by the way, the government had the speed to do it this time. Of course, everything was falling faster than it did in 0809. Yeah. But that speed actually caused, in our view, some of the upward reaction, saying the government's here to support us. And of course, the most important thing is the stimulus package that passed, I guess, unanimously through the Senate and got $2 trillion into the hands of American workers. We just completed. Jamie Dimon reminded our shareholders the other day, when have you ever seen the government get something done in 3 weeks? President Trump literally signed the bill 3 weeks ago, and we spent $349 billion and put that into the hands of small businesses all over this country, trying to retain their employees and trying to keep people employed. That's really great speed. Plus the checks, I guess, have gone out for $1,200. So things are moving. Whether it's enough, nobody knows, because we don't know how long it's going to last. But I do think we can credit the government with some of this relief as well, don't you think?
I think I've lost your connection. It sounded like you said we
should.
Marty, the small business loans, the $350 billion, that took 2 weeks to do, 14 days to do, I think 14 years worth of Small Business Administration backed loans. Like the number, something like that. It's unbelievable the rate at which it worked. I'm not yet ready to be crediting the government with much at the moment. They did what they were supposed to do, and they haven't done enough of what they were supposed to do. So, statistically, I'll tell you, we moved faster than we had, but I'm still sort of stuck on the fact that some of us were on this a lot earlier, and had we done it a lot earlier, we could have been yet faster. So I'm going to grow hair on my head before I'm ready to give the government a lot of credit right now.
So when would you have started that, Ali? I mean, would you have started it in February before we had a death in the United States? Remember, I reminded you the first death in the United States was February 27th.
Marty, the good thing about what I do is it's on tape. We can go back to the beginning of February. We can go to the end of January, where I had healthcare, public health experts on saying this is going to be very serious. We're going to get community spread, and then it's going to multiply, and we need to be taking this seriously. And we had people in our government, as you know, calling it a hoax. saying numbers are going to go down. That was the time to make the correct decisions, and we didn't do that at a national level. So where the technical successes have been, and I completely agree with you, the technical successes in getting these things passed and getting that money out. There have been some glitches, as you said. We've maxed out on the $350 billion actually this morning, so it's a bit of a problem for other businesses. But fundamentally, leadership was absent, because I shouldn't know more than our federal government should know about what's going to happen with the disease, and in this case, I apparently did.
Okay, so we'll watch the drama play out. We'll end this segment just watching the drama play out. How long is it going to take to get the next $250 billion into the hands of small businesses? Because as we know, that is the major portion of it in this country. Most restaurants, as you mentioned, had maybe 3 weeks of cash on hand. They were basically hand to mouth, and those restaurants and many small businesses were undercapitalized, as is normal when you own your own business. And so we'll see how long this drama plays out inside the loop to get the next $250 billion into the hands of employers, employees, and not do complete destruction of our economy. And I'm going to take your comment. Now, let's move on to normalcy. Dr. Fauci said at one point in time, we do not make the timeline. The virus is making the timeline.
Right.
And that's your point, I guess, is that, we should have seen the timeline sooner. But now we had the president come on this evening and talk about a three-phase recovery process left to the states, at least for this moment. So normalcy, let's try our best to define what normalcy will look like and how will we get there.
So I think, first of all, the error, and this is not part of my criticism of the government, but the error isn't thinking about anything as a date certain, right? The idea that the president had floated Easter Sunday, April 12th, it's just the wrong way to think about this. And that's, again, that's not part of my criticism. That's just something I've learned from public health experts, that the date won't matter, and the date won't matter depending on where you are and where you are in relation to the peak of the illness in where you are, and whether you conduct your life like you do in Houston versus the way I do in New York, right? Things are going to be harder to achieve normalcy in New York than it ever will in Houston. And it'll be easier. I think North Dakota has mentioned that they're ready to lift their stay at home very soon, if not in the next few days. But North Dakota's population density is I think it might be the lowest or second lowest in the United States. So I think we have to, today's phased approach seem much more sensible. And the point is, when you achieve these milestones is when you will open for business slowly. And then there's the added thing about that's what the federal government says. Obviously, it's for the state governments to decide how they're going to do it, but it seems sensible. And then let's say they open New York for business on May 15th. That's the current thinking. That's the date that until which non-essential businesses have to stay closed in New York State. Now, again, New York City is not the same as Buffalo or Albany or places like that. But will I, on May 15th, be going out to celebrate that lifting of the businesses? I mean, restaurants will be open. They'll have sales. I saw a restaurant today saying, buy a 25% bond redeemable when we open for business. So you'll get a 25% discount. People are coming up with all sorts of creative ways to keep businesses open and to keep them going. So we are craving normalcy. We're trying to save the old way of life. And I wonder how much of it we're going to be able to save. We will have to take our cues from the infection, which means from the health professionals, which means from our leaders. And that's what's become confusing, because our leaders have not been in sync. So in Michigan yesterday, you probably saw this, there was a protest at the state house wanting to lock the governor up because they have a stay-at-home order. That's the kind of stuff will we all be in the same place on the day when we're supposed to lift the stay-at-home order? Some people are not in the same place right now. Some people are frustrated. So the thing that we have to think about, you and I think about in market terms, we have to think about in societal terms, animal spirits, right? Success will be based on what people believe is possible at the end of this thing. do we believe there is some return to normalcy, or are we in our families going to say this is never happening again? We're not riding the subway again. We're not staying at hotels, or we're only staying at hotels that say that they've got UV lights and sanitize all the time. We're not going on. United Airlines says it'll do this, but Delta says it'll do this. So we're going to only fly on this airline, not that airline. That's what we don't know. And the problem with an infection like this, it's sort of like war. You've got to trust your leaders. And what we have right now is a crisis of trust. So we don't know exactly who we're listening to. And when you don't know who you're listening to, what you do is you make the decision yourself, right? We all become cavemen.
So then you would be an advocate for contact tracing a la South Korea and a la Taiwan, where everybody on their phone was forced to put a chip in here, and the government would tell you where you could go and where you couldn't go.
So in
and
fact,
the screen goes green.
I'm not in favor of it, largely because we allowed the government to come into our spaces after 9/11 because we believed it was existential, because we believed our way of life was at stake. And we have now realized the extent to which we have all given up our privacy and security to some degree for reasons we allowed, because we didn't really take that all that seriously. If you don't think that coronavirus is existential, if you don't believe that it's fundamentally going to change your way of life, why would you make that decision to do it? It's not a hard no to the idea, because Apple and Google have come together to do contact tracing. And if it's when your life is on the line, it may make most sense. But you just touched on something really important. This is where I think the discussion has to be. How safe do I feel? What am I willing to give up to feel safe again? And how will that reflect the way I shop, the way I live, the way I eat, the way I socialize, and the way I invest in the world going forward? And I think we'll be a lot smarter in 6 months and in a year from now. But that particular example of contact tracing alarmed me, because I don't know in 2020, after spending years complaining about how much information the social media companies and the government are able to gather on people for possible.
We're gonna leave the ambiguity behind by you're saying that the government has to make these decisions for us.
The government has to be coordinated. They have to be organized, right?
But at the end of the day, these are individual decisions.
Fauci's not saying fighting with Cuomo, who's doing something different than these governors are doing. That's what you got to not have, right? We've got the president selected a commission about how we get back to work, but not really listening to them. Coordinated effort, coordinated global effort is what we need. I'm not saying trust the government. I'm saying if you can't get a coordinated response from your government, then you end up making decisions for yourself. And we don't know what those decisions are going to look like.
Well, one thing we know is that nobody's going to ring a bell and tell us it's safe to play, or we can go out to the playground now the way they did when we were in grammar school, right? There's not going to be a bell. It's going to be individual choice, because that's the freedoms that the American people and frankly most of the Western world is used to, which always will have a risk in it that the disease will return. And the second wave, we don't have time tonight to examine the risk of a second wave, but that's one of the conversations. There are commentators who say, no, we have to be locked down for 18 months. Well, you keep a country of $330 million locked down for 18 months, you might as well go back to the Stone Age, because you will destroy every business and every source of employment that exists in the country. And we have to figure out when there is safe to go out and take a risk. But that time is not going to be guided by.
It's not going to be binary, like you're saying, right? Because for some of us, we will have already got immunity, right? In theory, according to Dr. Deborah Birx, within a couple of weeks, we'll have adequate testing to either figure out, and again, they've been saying we'll have adequate testing for a long time, so I don't know, but either you should be able to figure out whether you've got coronavirus, COVID-19, or whether you've had it. If you've got it, there's a course of action. If you've had it, you can go back to work. Now, let's say you haven't had it. We do know about the things that you can do to keep safe, right? Protective gear, as I said, UVC lighting. There are things you can do, so we can start to build that into our society. And within 12 months, we should have a vaccine. So I don't think we get to 18 months anyway, but I don't think we get to 12 months, right? For some people, they could go back to work this week. If I knew I had an antibody to this disease, there's no reason for me not to be in public.
Yeah, but that, at least as far as we know for this particular disease, number one, it's a relatively small infection rate relative to, let's say, H1N1, which, as I told you, was 24% or something.
Right.
But at the same time, the testing, and it's about testing, it's going to be about testing. And that's what they talked about in the president's plan tonight. And I think a lot of us are very hopeful that the medical industry can get to a point where quick and accurate testing will be something we can all rely on. And then there's the whole question of a vaccine. We don't have time to get onto that, but I will say that when we will all feel the bell will ring when we have a vaccine. And next year, we're vaccinating as many people as we do each fall for the common flu. And hopefully we'll get to that. Some people say 12 months, some people say 18 months. Hopefully our innovators will be able to get to there in a reasonable period of time. Let me just give you a real quick question before we get to the audience here. Economists suggest there are 4 types of recoveries. There's a V recovery, a quick one. There's a U recovery, something like this. There's a double recovery. I can't do that with my hands. Or maybe there's an L recovery, meaning that it's going to take 10 years to get out of this. What is your best guess, given your experience and your knowledge of the situation?
So I think it's a deep V. It's much deeper than any recession we have seen. It may end up being deeper than the Depression, but I don't believe that we are going to destroy all demand. I think there's some demand replacement that we're going to have, right? So there's some demand that you always lose in these things. I guess the opposite is something like a hurricane or an earthquake, where the economic activity to make up for it is, makes up for and sometimes exceeds what you lost. I think you're going to have a very steep collapse, but you're going to have a quicker recovery. And JP Morgan Chase thinks so, and a lot of the banks think that, look, this recovery is not a 5-year recovery like others have seen. It might be a 2-year recovery. It might be a little longer. I actually happen to think it'll be more robust, because we will learn quickly. You're right, there won't be a bell, but we will suddenly learn that you don't turn on the TV and the death toll's not up, and people around you are not succumbing to this thing. And it will, I think the nature of the human spirit is generally positive and optimistic, and the nature of the American spirit is yet more positive and optimistic. So I think that insofar as people have been able to stop the spread of this disease by their behavior, people will be able to get this economy back by their behavior at the end of it, which leads me to believe this is not a long build. I think we will have greater structural inequality in society than we had going into this, which was probably the intractable problem of our time, in that unemployment was low, and yet there was so much wealth inequality. We hadn't quite figured out how to deal with that. We were thinking about increasing minimum wage, and we were thinking about universality of healthcare. We have started in this deal, this $2.2 trillion deal, a system of paying the airlines, giving them grant money to keep their employees paid until the 30th of September. That's a model that was used in Denmark. It's typically employed by Western European countries, hasn't been done in the United States. If it works, it might be an interesting model for us. Stay on the payrolls, don't get unemployed, with the understanding that your company is coming back to life and you can get right back into your job and start working again.
Well, that's a positive outlook, I think, and I appreciate that feedback. So we've got a number of questions. The audience is active here. Let me get some of these to you, okay, Ali? First one is from Paul. What can the strategists learn from current recovery efforts in China and Korea?
So I need to put China in a separate basket for the moment, because we don't know enough about China. In other words, we think we know a lot about China. China's released a lot of data and a lot of information. But Marty, you and I have known for a long time, one of the issues with China is that you always have to verify the information you get from them, right? So when they say they had this kind of industrial output, we measure it against satellite images that show heat output from factories to make sure that the trend line is in the same place. So I'm not 100% sure about what takeaways we should have from China. I think we might actually still have some issues with how much information we're getting from China. South Korea, we had much more stringent testing. South Korea is an interesting hybrid type of government. It's a democracy, but it behaves a little bit more like some of these countries that are a little more paternalistic than we do. So they tend to listen to their government more than we listen to ours. So you can impose strictures and behavior controls on people better than you can in the United States. I think there are a number of examples of countries you can look at for both good and bad. Iran was a massive failure at this. Italy was a terrible failure at this, and Spain is not doing particularly well either. But there were some Asian countries. Singapore was probably the best example, but for reasons that our audience would probably understand. Singapore can generally handle things that are best handled by government better than a lot of countries
Well,
can.
I will tell you, Singapore eased their situation too quickly, and they're having their second wave right now.
Resurgence, right? But they can probably put a lid on it as fast as they had it the first time.
I hope they can. Anyways, let's go on. Thank you for that. So Pat asks, the creation of jobs and creation of healthy economic conditions for workers aren't the same. And you kind of referred to this earlier. I think it's interesting. How do we create a healthy economy without sacrificing wage fairness and adequate healthcare benefits?
Yeah, I don't think those are opposites. I think about labor laws that are in place, and I think about the reasons they're in place, and I think about the Triangle Shirtwaist Factory in New York, in which lots of people died, mostly young women, because the doors were locked; they couldn't get out in a fire, and that led to a whole bunch of occupational health and safety laws that exist today, which is why so many Americans are free to say they don't like unionization, because the things that unions were fighting for became the law. At a very basic level, other than wage and healthcare. And it's why when we're fighting for more universal healthcare, a lot of unions are coming out against it, because that's what they were fighting for. So on one level, we've got a lot of laws that can be adjusted to protect workers. On the other hand, when you go into a workplace where you have that OSHA placard that says what you're entitled to, our our ability to enforce that, OSHA is enforced, occupational health and safety is enforced on a federal level and a state level. On a federal level, we have enough enforcement ability to enforce every business once every, Richard Trumka from AFL-CIO gave me this number the other day, like something like 160 years or something like that, once in 160 years. And on the state level, I think it's worse. So we don't have any labor health code enforcement that is effective. So I think we have to have general agreement on what does a healthy workplace look like in the future. And how do we ensure that people provide for that healthy workplace? I think it's going to be one of the most important discussions. It's happening a little bit now, but that's the one we should not get away from us, because if we can figure out how to keep people safe at work, then the next time something like this happens, it's not going to be as bad.
Right. I'm going to ask and answer a question here myself, if you don't mind. Do we have safeguards, Pat asks this, in place to prevent the damage to the financial, mortgage, real estate sectors that occurred in the past? And I think one of the things that the Fed did in the early stages of their $2.2 trillion package was to do everything they could to leave liquidity in the markets, to create liquidity. The markets went crazy, particularly the debt markets, and it helped the financial markets. Number one, our banks are much better capitalized than they were going in 2008, 2009. So that's a very good sign, and I don't think anybody really needs to worry about the banking sector. The real estate sector, of course, is also sometimes after a 10-year upward movement, people get a little aggressive. They start putting too much debt, and a badly structured business may not be savable in an environment, and the government doesn't really feel like it has a responsibility, I believe, to necessarily fix badly structured businesses. The energy business, there were a lot of very badly structured companies in the energy business where there was too much debt, too little cash flow. And those are difficult things for, let's say, a government to step in and save. This is a capitalist society, and I think that some of those elements are just going to have to be worked out. Do you have any thoughts on that?
Yeah, and I think this is the one part about the recession from 2008, 2009 that we have to think about, and that is we didn't really fix our way of thinking about debt on a personal level, on a consumer level, or on a corporate level. And I think that we do have to realize that if you want the government to step in the way the government just stepped in, it's not the same. Not everybody's the same, right? Am I stepping in to save you because you were a badly structured industry that didn't have any ability to do things? What we have learned is certainly small businesses are just like individuals, right? We should, Susie Orman says, we should have 6 to 8 months of cushion in our lives in case we lose a job. But what we learned from the government shutdown last year is that most Americans don't. Same thing with small businesses. Wouldn't it be great if every small business had 6 to 8 months worth of cash available? But they don't. That's the nature of the way things go. But even large businesses, we do have to have a conversation about debt. We've stopped having that conversation, Marty, on every level, including our national debt. It's just fallen out of favor to have a reasonable discussion about what's appropriate for a country, what's appropriate for a company, what's appropriate for individuals in terms of debt. It may be the best cushion we have for the times when things like this happen. I'm glad we're sending money to individuals, but I'm getting emails literally from people who don't have enough money to make it through the week. And I'm thinking to myself, there's just something wrong with our society when either people aren't getting paid enough to make it through the end of the week, or we don't have a good enough understanding of debt. And it's the same thing with companies. So I think we have to file this one away and have a very different discussion as we come out of this about how we should think about how much debt it's okay for us to have as a company, as companies, and as countries.
So there is a question here from Paresh that I think, and there are a couple of questions along this same theme, is how will U.S. relations with Asia change in the post-pandemic world, particularly as the administration cedes global leadership? I'll leave the last part about cedes global leadership. You and I can debate that. Maybe that's part of the question, but I think that the fundamental question is, will our relationships with Asian countries, and we got to think specifically about China here,
No.
will they be permanently damaged as a result of this? Don't forget, we had just signed.
Yeah, we were just coming out of
a major trade agreement, and that trade agreement had come after many years of rancor between the two governments, but it worked out. And now we've got another reason we're blowing whistles at them all day long. And obviously this is going to have an impact on that relationship.
Right. And for a long time we didn't blow whistles on China. And there are a lot of, and we made a lot of money out of not blowing whistles on China. So I don't know what right looks like, and you would know better than I would on this. I think that, because I just want to touch on the ceding leadership, only because I don't really want to blame this president for it. Everybody the president ran again in the last election said that we were going to get out of the Trans-Pacific Partnership. That's right. Bernie Sanders said it, Hillary Clinton said it, Donald Trump said it. I think that's bad policy. I think we enjoyed a premier position in Asia for a good reason, which we just do not enjoy in 2020. So we're going to have to work to rebuild that. You can't be at war with Asia. You cannot be at odds with Asia. We're going to have to figure this out. And we have stepped back a little bit, and China has filled that space. That's the natural way of things. So I think we're going to have a more sophisticated view of our approach to China. I thought this 3.5 years ago that Donald Trump was onto something about fixing the stuff that is wrong with our relationship with China. I'm not sure we went about it the right way, and we finally just started extracting ourselves from that, and we got ourselves into a confrontation with China again, maybe for very valid reasons. So the rebuilding or the stabilization of our relationship with China in particular and Asia in general is going to be a priority coming out of this.
So Matthew asks a question around, can we stay focused on getting out of this pandemic as we go through the political bickering that we're going to end up getting into over the next 3 months on our way to 3 or 4 months on our way to an election?
No. The simple answer is no, nor should we. The election's about our future in this country. They're not. You can chew gum and walk at the same time, and we should. We're going to have to figure that out. The election is going to be an important matter, and these are elections for grown-ups, right? Everybody wants somebody to come in and save them and tell them what it's going to be and all that. And I think what we learned is today, this is about you making choices, who you'd like to elect, what principles they stand for, what you share with them. So I don't think we should think about electioneering and debates as bickering. People may not like it. It may not be your thing, but it's actually about the future of democracy. So listen, I live in it. And so I often think it's bickering, and I wish people could speak with greater respect. I wish people could respect that others don't always share their views. And I think, Marty, you and I have done that a lot. We don't share a lot of political views, but it doesn't affect our friendship or our relationship or our productivity. I wish people could do that, but if they can't, it doesn't matter. It's still the way we make our decisions about the future of the country.
So Betty asked a very interesting question. Maybe this will be the last one I'll have time to do. Should we return to the gold standard?
For a lot of reasons.
I'm not sure that's relevant for this.
It's attractive, and every time we get into trouble, it seems to be. First of all, we're way too far off the gold standard to get back onto it. I don't actually think there's enough gold in the world for there to be a gold standard. But unfortunately, and this is more conversation than we've got time.
Well, that would be true if you set it at $35 an ounce, where it used to be, or whatever it was. Right? Maybe if you set it at $2,500 an ounce, that
maybe. Yeah, I suppose there's a way you can do it, but I don't know that it works in our society. And part of it is, and we learned this in 2008, is the degree to which our economy revolves around derivatives, right? Not what's in this bottle of beverage, but when I have a right to drink from it or to whom I can sell it at what price. It's so much bigger than an asset-based economy that genie's out of the bottle. I don't know that it makes sense to go back to the gold standard. I don't know what it made sense in 1979 to go back to the gold standard, but it's not actually something that's doable at this point. So I think we just have to
That kind of pairs
think
with
about managing the economy the way we have it.
and it kind of pairs with another question that came in from Matt, which is, does the Fed's aggressive response here risk breeding inflation? Now, of course, we worried about that for the last 10 years, 12 years, and we couldn't get inflation going. I mean, the Fed fought the last 12 years, putting more money into the system, exploding their balance sheet, and we couldn't create inflation. But gold and inflation generally are in the same conversation, right?
I don't know why this isn't more of a problem, and it goes to the thing I talked about with debt, right? If part of the reason we don't talk about debt is because we don't talk about corporate debt, we don't talk about national debt, because the consequence of debt is no longer there, right? The consequence of debt was potentially inflation, and we don't see that. I don't know. In theory, and I speak to a lot of economists who explain and spend a lot of time explaining why it is we should have been witnessing much greater inflation than we've had, and yet we continue not to. Now, the longer argument is that we continue to have lower relative wage rates at which we can produce our goods and our services. So that's part of the issue. We're going to run out of places to send things to be made for less money, and then inflation might become real.
Well, it's 8:30. The bell is rung. And so I've got one final question for you. It's an over-under question. We're gonna put this in Vegas. We're gonna have the next Asia Society conversation with you on September 1st of 2020. Will you fly or will you drive? The over-under is, will you do it?
We will be able to fly. I think so by September 1st, we will be able to fly. I will tell you, we'll be in the heat of an election. So I don't know if I'll be able to fly to another place. And now that we've got this new world in which we can all have conversations from our home, this might be the new normal. But I will never miss a chance to come back to Texas and to come back to the Asia Society, Texas. You are always so hospitable. Everybody knows I've loved Texas for a very long time. And you and the Asia Society are my particular strong connection to it. So we shall see each other in a few months.
Ali Velshi, we've been honored to have you with us tonight. Thank you so much for your wisdom and for your comments. And we're going to get you back here as soon as we possibly can, hopefully even before. I'm taking the over on that. I want you here before September 1st, okay?
I look forward to it.
Thank you for joining us tonight. Thank you, audience, for joining us. There will be another program next Thursday night at 7:30. Please look at the Asia Society website for the details of that program. In the meantime, please socially distance, be safe, and be healthy. Thank you.
Thank you.